I'd like you to look into the camera, and I'd like you to tell the people at home who lost loved ones while they were on the wait list what you did over the past 7 years to fix our healthcare system, because it's broken.
Oh boy, there were some fun moments at the Ontario Leaders Debate over the weekend, so I want to go over 3 clips that stood out to me. Now, keep in mind, this debate was an hour and a half long. It's impossible for me to properly summarize the entire debate in this video, but I do highly suggest, if you're an Ontario voter, go and watch that debate. I'll link to it below the video. It's worth knowing what each of these leaders and their parties are about. Before I get to the first clip, let me share where polling currently stands, because this election was called for no reason, except for Doug Ford. That I mean, even conservative Doug Ford voters know this. There was no reason at all to call this election except to extend his majority government, because he was in the spotlight during this whole tariff war, wearing that Canada's not for sale hat, working with the other premiers and Trudeau, looking like a leader. It's all marketing. So he's able to capitalize on this moment by launching this election for no other reason except to try and enrich himself. Now, that gets to where things currently sit, which is not surprising. Ontario PCs, Doug Ford's party, sitting at 46.4%, the Liberals sitting at 27%, the NDP sitting at 17.9%, and the Greens sitting at 6.7%. Now, this is Nanos data. Abacus data shows PCs with a little less support at 37%, Liberals at 19%, and NDP at 17%, showing a closer race between these two here. Greens down from where Nanos has them at 4% here. And in terms of where the government is, their approval rating, this is also down since Doug Ford called the election, because people understand there was no reason for this election. So it went from 42 to 38%, and that's as of early February. Now, in terms of the issues that people care about, this is very important, because you have to keep in mind, Doug Ford and his PCs have been in power since 2018. In that time, if the cost of living wasn't an issue, then reducing the cost of living wouldn't be the biggest issue that voters care about. If the healthcare system wasn't a problem, then improving the healthcare system overall wouldn't be one of the major issues that people care about. If homes were affordable, then making housing more affordable wouldn't be one of the biggest issues. These are 3 major issues that have gone not even unaddressed, but have gotten worse under Doug Ford's majority government. Yet still, he is enjoying a plurality of support in the 40% or higher, leading likely to another majority government. It is wild just to see the complete disconnect here between the issues that people care about and clearly things that Doug Ford has not addressed properly to what his support is. It's insane. Let me get to the first clip here, which is about healthcare.
The hallway healthcare crisis was invented by the previous Liberal government, but Doug Ford and his government have poured gasoline all over it. We have a crisis in our province right now. He can talk about how much he's spent on healthcare, but the reality is, talk to any Ontarian about the state of our healthcare crisis right now. It's terrible. We cannot afford not to invest in healthcare right now and make sure people have family doctors, but also nurses in our hospitals right now.
Okay.
Respected.
By your own admission, Doug, you put $1.8 billion into your plan for healthcare. You put more into the spa at Ontario Place at $2.1 billion. Yeah, you might build hospitals, but you're not recruiting doctors, you're not recruiting nurses, and you're not giving them the operating costs. I'd like you to look into the camera, and I'd like you to tell the people at home who lost loved ones while they were on the wait list what you did over the past 7 years to fix our healthcare system, because it's broken. We're in crisis, and you're bragging about what you've done. It's been an abysmal failure.
Doug Ford?
Well, Bonnie, what I will tell you, there's a reason why Dr. Jane Philpott, a liberal minister, comes to our team. It's very simple, because she sees the vision. She sees that we're building healthcare.
All right. Before I comment on anything, and I'm going to go deep on a couple issues here. One thing I really noticed throughout this debate is that Doug Ford did not look in anybody's eyes. He was looking in the camera the whole time. Bonnie Crombie there with some real emotion. Thankfully, I've been asking for other leaders to do this, to get angry at the situation, show that you actually care. Bonnie Crombie doing that, and Doug Ford will not look at her. And then his defense is amazing. And I'm so glad that Crombie there called it out. Your solution to healthcare was to hire a liberal. It's like, at that point, shouldn't voters be asking, why not just hire the whole party? Why are we sticking with Doug Ford when clearly the liberal has the solution? It's just it's so wild to see the complete disaster that is healthcare. And Ontario is the outlier here. They are the worst in all provinces compared to all provinces when it comes to spending on healthcare. Uh, just to share a bit of this. So, some examples. This is from CBC. We're seeing a Hunger Games across Ontario. Hundreds in this town line up for a chance at a family doctor. Take a look at some of these images. These are people lining up to try with the chance of potentially getting a family doctor. So, another image here. There were only 500 spots for this family doctor who was opening up a facility in Ontario. So, people, this is in Walkerton, lined up starting around 2 a.m. for the opportunity to have a family doctor in their area. This guy, who I guess got a spot, looks like he won the lottery. It's just so sad. An increasing number of Canadians have no access to a primary care doctor, particularly in rural areas. So this is a serious issue, and it gets to a lack of funding, a lack of being able to attract doctors and nurses to Ontario because Doug Ford has capped the pay on nurses. So nursing staffing, I covered this before, but nursing staffing agencies are costing Ontario hospitals untold millions. So Auditor General report finds agencies charge hospitals as much as $160 an hour for a registered nurse, which is about double what the government is willing to pay them. So they're finding that staffing agencies are filling the gaps by hiring agency nurses at significantly higher hourly rates than they pay the nurses they directly employ. Ontario would not be in the same staffing crisis if the government had not capped nurses' salary increases. So nurses, of course, because of this, are being driven to join privately run staffing agencies because they aren't being paid enough at their hospital jobs, leading to the government essentially paying a lot more than they should be for nursing if they just paid the nurses directly. So there are these staffing agencies where someone's getting a cut here. Obviously, these are privately run companies doing the staffing. Why are we giving these paper pushers a cut of this as opposed to just paying the nurses directly? Quote, when it comes down to it, this is all about the government diverting more of our public healthcare dollars into their private shareholder friends' pockets. And that's a quote from Ontario NDP leader Merritt Stiles. Another issue, as I briefly mentioned earlier, health spending in Ontario, the lowest in Canada. So, yeah, it is absolutely terrible here. And Doug Ford, we've increased funding in healthcare. But again, you have been in power since 2018. Why was this ever an issue? Why is Ontario the lowest in the entire province? And why, while this is happening, does he still have the support that he has? It's an issue of media. It's an issue of the other parties not properly, whether it's getting in media or getting the attention that they deserve to be able to talk about these issues, whether people actually care. Like, people clearly care about healthcare. You poll them, you ask them just in their daily lives, like, have you had to get healthcare? Many of them have had to go to hospitals where the wait time is hours upon hours. Average wait time for a hospital, I think, is around like 16 hours or more. Like, it's wild. Yet those same people will turn around and go vote for Doug Ford. I just I am failing to understand why people will settle for this absolute garbage. But let me get to the next clip. This one is about crime.
80% of people in provincial jails right now in Ontario are awaiting trial. One of the reasons people who are accused of crimes are getting off is because there's so many delays in the Ontario courts that they get out because of that. And now this Mr. Ford wants to make it even worse by criminalizing people who are experiencing homelessness. We need to invest in housing people, not throwing them in jail. We need to invest in treating people with mental health and addictions challenges, not threatening to throw them in jail. People need public services. That's what a caring Ontario looks like. That's what fighting for fairness looks like. Ontario Greens will put care over crime.
That is time. I will turn to Doug Ford because his record has been challenged on 2 occasions. I'll give you 30 seconds.
Well, thank you so much. As the Liberals were closing jails, we're building jails. As the Liberals and NDP were getting rid of our police, we're hiring more police. Actually, over 2,000 more police officers through our colleges, and we're paying for their education. Yes, I believe in making sure we hold people accountable. You know, I find it ironic that you, Bonnie, are saying about the police. You said on tape that you're scared of the police. And as for you, Merritt, your own members want to defund the police.
All right.
Like, who wants to defund the police except the NDP?
Paying for more police does not reduce crime. I don't know how many more studies have to be done about this before this gets through people's thick skulls. Paying for policing doesn't stop or reduce crime. There's data after data. How about our own eyes? As we see police budgets balloon, crime is also increasing. Why? Why do you think the solution is more policing? When clearly up to this point, that is not solving the problem. This is another point where it's just like I'm smashing my head against the wall trying to understand how lines like this still work on people when clearly the facts show otherwise. While annual police budgets continue to grow, there is little debate in the media about its cost to taxpayers and the value for money in relation to crime reduction. This 50% increase over inflation in the cost of policing more than 20 years ago is now coinciding with disturbing increases in violent crime. So homicides up, violent crime up, returning to levels seen 20 years ago. Canada's homicide rate is second only to the U.S. Like, it's more policing is clearly not the solution. Though much of the rhetoric for justifying increasing police budgets is about crime, an analysis of trends over the last 20 years in Canada could not find any correlation between increases in municipal police budgets and a reduction in crime rates. So a simple comparison between Chicago and Toronto, which have almost the same populations, shows that Chicago's 13,000 police officers, 7,000 more than Toronto, have not been enough to close the gap from Chicago's 600 homicides annually to Toronto's 70. Do you need a clearer example that more police do not equal less crime? So there's, by the way, I'll link to this below the video. There's a lot more in this, but as you can see, I was highlighting like crazy. There's so much I want to mention here. Canadian experts have cited a 2010 study that found for every dollar spent on enriched childcare and parenting programs, the community gained roughly $7 worth of benefits in reduced criminal involvement and cost to the justice system. Actually investing into communities, into childcare, into healthcare, into housing. This is how you address. If crime is your number one issue, this is how you actually bring down crime rates and address it, is through preventative measures. Stop and Plan Now, which is a Canadian program that counsels young people on how to deal with emotions in social situations. Studies have found that also returns money spent by reducing crime, by reducing the impact that people may have on the system in various ways. Life skills training for youth aged 12 to 14 years old, reduce alcohol and drug abuse and violence with a cost benefit of $25 per spent. I mean, and again, as I mentioned, housing. So this from the Denver Voice. There have been so many, again, studies and examples of this. But as they break down here, a new working paper from the Federal Reserve Bank of Kansas City found that Housing First programs, which provide housing assistance without precondition, reduce crime rates and improve employment outcomes for people experiencing homelessness. For example, short-term Housing First programs, also known as rapid rehousing, caused individual arrest rates to drop by 95%. Dependence on cash benefits also dropped by 80%, and the use of social services dropped by 35%. When you give people homes, their need to depend on other things, like the healthcare system, like various social services, that decreases, and you end up actually saving money because of the lack of dependence on other aspects of the system, be it, again, police, another example. These things you need less because people have a home, they're safe, and they're able to actually create their lives. But you have this like police first strategy that these conservatives always employ, And you wonder why crime keeps increasing, because it doesn't actually address the problem. Let me get to the last clip here. This is just a bit of a debate between Merritt Stiles and Bonnie Crombie, the NDP leader and the Liberal leader. And I just found this to be interesting because of Bonnie Crombie's non-response.
What I'm finding increasingly as I go around the province is that people are paying out of pocket for healthcare, for actually things that we, as Canadians believe should be absolutely free. You should be able to access healthcare when and where you need it, not out of pocket. And I was really shocked to see that the Liberal leader, that her party has received $25,000 in donations from private healthcare insiders.
Do you have a question?
And I'd like to know how she can stand here and say she's going to save healthcare, which, by the way, was created. Holloway Healthcare was created under the previous Liberal government, when she's receiving those kinds of donations from private healthcare providers.
Okay, we'll get.
Yeah,
Bonnie
I
Crombie.
think the NDP leader is envious of my fundraising record to date. I will say that the NDP thinks that money grows on trees. You just can't promise everything to everyone all the time.
Okay.
That's just not a serious plan. It's not a serious plan. When I was the mayor of Mississauga, I had to balance my budget. I never ran a deficit.
you're
I
answering my
did that
question.
for the past 10 years. I balanced my books for 10 years,
I'm
just
asking-
like people have
maybe
to
I need
do
to be
at
more
home.
clear.
They have to balance their budgets at home. They know that they have to save in bad times. That's the difference between me
I think I need to
and
ask this
you.
question a little bit more clearly, maybe. You said that you are going to fix the healthcare crisis, that a previous Liberal government, I will argue, started the whole Holloway healthcare crisis, right? You don't take responsibility for that, but you also will not take responsibility for the fact that you have collected $25,000 from private healthcare insiders at a time when we are seeing people literally having to pay out of pocket under Doug Ford's government for healthcare. Ontarians are very
Can I
clear.
jump
They do
in? I
not
mean,
want to head in that
certainly,
direction.
we follow the rules to the T. Absolutely. And
So
I
why
have
are you
a plan
collecting
that will
donations
I have a
from
plan that will
private
invest $3
healthcare
billion,
insiders?
not the 1.8 that the premier is going to
5
do.
seconds.
How do we know it's not gonna go
$3 billion
to,
to
private
ensure that
healthcare?
everyone in Ontario
How do we
has
know
a
it's not
family
gonna go to
doctor.
private health?
That is my
time.
pledge.
That is time.
I gotta say, nothing has made me question the Liberal plan for healthcare more than that clip. All Bonnie Crombie had to say was, I take money from all kinds of people. It doesn't mean I'm going to work for them. But she really avoided that question about private healthcare interests giving her party money in this election. This gets to an issue that has just been wild under Doug Ford, and that is for-profit clinics. This slow move towards privatization of healthcare in ways that I feel should be illegal, but they're skirting around it. Doug Ford government paying for-profit clinic more than hospitals for OHIP-covered surgeries. So the way that Doug Ford has addressed this issue with, lack of healthcare is by handing money to for-profit interests, paying them more for the same surgeries than what he's paying to public hospitals. So an example here, the Don Mills Surgical Unit, which is a private facility, they charge the government almost double for the same procedure. Or this knee surgery, almost 3 times more than public hospitals. So a director of surgery at another hospital says those funding rates would allow significant profit to flow from the public purse to the clinic's owners. That's where our money is going. Quote, if I were running that center, I would be a millionaire, said the surgeon. There's a ton of money to be made. Why is the Doug Ford government handing our money to for-profit private healthcare interests when that money could instead be given to actual public facilities? So I don't think that's the Liberal plan to continue that, but it's sure bizarre to be so afraid of addressing that question that Merritt Stiles brought up. That said, if you are an Ontario voter and you are voting in this election, I would just suggest voting against the PCs. It looks like Doug Ford's going to likely have his government anyways, but you could, if this video got out to every single voter, maybe that could change. Just vote. Look at your riding. Look who historically is doing well. Maybe there's some polling in your riding, or you get a sense of who's doing well. Whether it's the NDP, the Liberal, or the Green, vote against whoever the best candidate in your riding is, whoever the best candidate is to go against or to defeat the PC candidate in your riding. So That's where I stand on this. I think it's very important for people to go out and vote. The only reason Doug Ford was able to have the kind of mandate he did last time is because nobody voted. If you actually go out and vote, things can change. Unfortunately, not many people that need to see this video are going to see it. But if just enough do, maybe you can help to change the election and not hand Doug Ford another majority government.